Hey, this is Nick Fogelson from Northwest Endometriosis and Pelvic Surgery. Haven't done a video for a while, but had a thought that I wanted to talk about, and that's a little bit about what is normal to feel after endometriosis surgery, because it's such a common question I get where a patient will say, I have X symptom, is this normal? And my answer is almost always, well, it's normal for you right now. And it sounds a little flippant, but the reality is that when we do endometriosis surgery, we're removing a bunch of tissue from the inside of the pelvis. We're creating an open wound that the body needs to heal. That's going to create inflammation. If we were near nerves during the surgery, there's going to be inflammation around nerves. That may make sharp shooting pains. It may make weird sensations in the skin. It might make some numbness. It might make some dull aching pains. So I don't know what people are going to feel exactly. If a patient tells me what they're feeling, I'll be able to tell them what nerve is irritated, creating that sensation most likely, but it doesn't mean I'm going to do anything about it. The way I think about post-operative management is that I'm going to do in the operating room the best possible surgery I can. I'm going to take as much time as I need to do the surgery I think is the best surgery I can do. I don't put 5 surgeries on during a day because I don't want to have to rush through anything. I'm going to do as good of a surgery as I can. And what that does is it frees me up to not worry about, do I need to go back to the operating room? I already did the best surgery I can do. So if a patient is having problems after surgery, what I'm concerned about is, do they have something that is really wrong? Do they have a hole in the bowel? Do they have a hole in the urinary tract? Do they have an abscess? Do they have a bowel obstruction? Do they have a big blood clot in their pelvis? Because any of those things might require that I intervene. I might need to put in a drain, I might need to reoperate, a variety of things might need to happen. But those kinds of things are really, really uncommon. But it's important that we make the diagnosis of those things if they're happening, because some of those things could be life-threatening. If you don't intervene, the patient will just get sicker and sicker and sicker until they die. Now that's not going to happen, but because we're going to find out they're getting sicker. But almost all those things, the sooner you figure out that something is going wrong, the better it's going to be for the patient. So if a patient is having unusual pains after surgery, I'm often going to check. I'm going to get labs. I may get a CAT scan. But if all that is negative, then I basically don't care what they're feeling in a way, because it doesn't really have that much of a predictor of how they're going to do in the long run. My general feeling about endometriosis surgery is that a lot of patients will have various symptoms a week, 2 weeks. Some people do great immediately, but how they're feeling 2 weeks after surgery is really not predictive of how well the surgery is going to work. It's 3 to 6 months after surgery before we say, okay, everything's finally healed, where are we? So when a patient has X symptom and say, is this normal? I'd say, well, let's make sure it's not something we need to intervene with. But if it's not, it's normal for you. And what can we do just to make you feel better in the meantime? So we may give them some additional pain medication. We may put someone on Lyrica if they're having kind of some pain, nerve type pains. We'll try to get into PT, maybe acupuncture, make sure they're getting moving around, and then just give the body time to heal. And some people heal slower than others. Some people are more inflammatory than others. There's just a lot of different things. The other thing that's just a kind of funny aside is that if somebody has really bad abdominal pain after surgery, 9 times out of 10, 95 times out of 100, it's because they're constipated. And you get a CAT scan. They can come to the ER writhing in pain. And if they don't have a fever, and they don't have they don't look like they're dying, they're probably constipated. And you get a CAT scan and their colon's totally full of stool, and you give them a lot of laxatives, and that will fix the problem. And then once they have a bowel movement, they're feeling better. So just to kind of sum up, you can get all kinds of weird symptoms after endometriosis surgery. We're cutting out tissue, and the body has to heal. And it's not just the incisions that are in the belly. There is an injury on the inside of the pelvis that we have created. Surgery is a controlled injury, and it's a controlled injury for the purpose of making things better. But in the short term, it's an injury that you need to heal from. So you can get all kinds of weird symptoms, and if it's not something that needs to be intervened with, then we're generally not going to do anything. The The other side of that is that sometimes when something does need to be intervened with, but it's not critically ill, it can be hard for the primary surgeon to figure it out, because the primary surgeon already did the best surgery they can, and they don't want to like neurotically be rushing back to the operating room every time something is going weird. But sometimes if another surgeon gets involved, they look at it and go like, this just isn't normal enough. I'll take a look. I mean, I've had patients come to see me who have been, quote, neglected by their surgeon because they're just not doing well after surgery. And the surgeon just says, just give it time, wait for it to heal, such and such. Probably what I would tell the same patient if they were my patient. But because now I'm looking at it and I'm not emotionally invested in what happened in the first surgery, and I don't know what happened in the first surgery, so I don't have this strong sense that, okay, I did everything I could do, like there's nothing more I can do. I'll say, okay, I'll take a look. And I have had patients where I go back and look and I find that there's like some low-grade infection that was not fully diagnosed or something that is going on. So sometimes it comes up that like weird things are happening after surgery and you do end up having to look, and sometimes it ends up being a different surgeon that looks because it's hard for the first surgeon to like differentiate that patient from every other patient that sometimes is having some problems after surgery. Medicine's funny that way, and it's not necessarily a reflection on the first surgeon, because like the second surgeon might have done the same thing if they had been the first surgeon. And so that happens sometimes. I had a patient that came to see me from England who had a surgery from a very good surgeon in England. I can't say anything but great things about that surgeon, but hadn't been doing well after surgery, and that surgeon was kind of not wanting to do much more about it. And she contacted me, and I said, yeah, I'll take a look. And she did have like a chronic abscess that some sort of infection had set up, and it wasn't adequately detected. And we cleaned it all out, and she felt better. So, it does happen. So a lot of things are normal, but at the same time, like if things persist and persist and persist, then you work it up, and if patients continue to do poorly, then sometimes we do more. So it's a little bit complicated. It's kind of like a little wishy-washy in what I first said and second said. It's complicated, but part of that's what comes from the experience of having done this for a long time, is that you start to see lots of different things, and what are you going to do? So underlying message is everything's normal after surgery as long as you're not really sick. Unless it goes on for a long time, then sometimes we have to look further. As a total aside, as I watch this video, I also find something else that is normal, which is that if you leave a Lego set with lots of white pieces out in the sun for a long time, it starts to look yellow. It's kind of sad. That used to look really white. See you later.